September is National Suicide Prevention Month. Organizations and communities around the country and here in Connecticut are raising awareness, promoting hope, and offering help to those who need it to save lives. Joining us now is Dr. Javid Sakura, Chair of Psychiatry at the Institute of Living at Hartford Hospital. Thank you for being here, Doctor. Appreciate it.
Thank you for having me.
Suicide is the second leading cause of death among people between the ages of 10 and 34. Tell us why this awareness campaign is so important.
So it's extremely important because we have to, first of all, honor those that we've lost, their memory, and all of those that are affected by the loss of members of our communities and our families. But it's also important because suicide is something that's largely preventable. It's something we create awareness of because the more that we know and the more that we can be connected and attuned to each other, the more opportunities we have to prevent this tragic loss of life that happens when people die by suicide.
Most often when people hear of somebody committing suicide, there is shock. You cannot believe it. But there are, in fact, warning signs often of this problem. What are they and what should you look for?
One of the most important things is that when we start to see someone becoming detached and disconnected from their families, from their communities, from their lives, it's those signs of detachment that can be the most concerning. And they're a reminder to lean in, to offer connection, and to remind people, first, that they're not alone, and second, that help is available for anyone who needs it.
Talk about a difficult conversation to begin that takes some courage and know-how. How do you encourage open conversations and how do you engage in those conversations?
It's certainly not easy, but I think one of the most important things to do is say what you see. Simply describe what you might be noticing in someone, describe what might feel or seem different, show that you care, emphasizing that connection and compassion. But it's also important to know your role. No one can be a therapist for everyone, and that's why helping connect people and sharing access to resources is a crucial step in helping prevent suicide.
And what kind of help is out there for people if you identify a problem or you can help a family member make contact? What kind of help is out there?
So it's important to remember that just reaching out itself is a very important step, but at any time of day, at any day of the week, 988, the National Suicide Prevention Hotline, is available. But further to that, accessing healthcare supports, accessing mental health care supports are all available through your family doctor or through hospitals or agencies in your community.
Dr. Javid Sakura from Hartford Hospital, we appreciate your time. Thank you for being here. As the doctor mentioned, if someone you know might be struggling, you can call or text 988, the Suicide and Crisis Lifeline.